Welcome. And if those of you who do not know me, I am Dr. Arati Thapa. I'm the current chair of NDA UK. I'm a practicing GP. As you can see, I'm in my clinic in a very busy day when the resident doctors are on strike, which means the GP land is overwhelmed. So I will be coming in and out of the webinar, but it is a great pleasure that NDA and its executive members are hosting and moderating these type of courses. Today we have with you Shakya, who you all know. She's already an IMT 2 trainee at Sheffield. Hamal, who is at IMT 1 at King's College London. Sanjay Shrestha, who is at Tunbridge Wells IMT 1, and Abhishek Tamrakar at Sheffield Teaching Hospital. I am hoping that this webinar will prepare you and empower you to do your proper interviews. In medicine, we all know that learn one or show one, do one, and teach one. That is a mantra we all medics have been hearing all our life. And today, these 4 doctors in front of you are doing exactly the same. They have been through that. And now they are teaching you, letting you go through the process, which will help to solidify your knowledge as well as your competence and your understanding, which will really empower you in your interview. So over to you, Sasha, as a moderator, and let the candidates go through answer their queries. I will try to jump in and out. Dr. Ashish Shrestha, the Vice Chair of NDA, is also in the scene, and depending on his availability, he will be jumping in and out as well. And we are there to support you. And at the end, at 11:15, I'll join again. Is that okay? Thank you so much. Over to you, the moderator, Dr. Sasa Shakya, okay?
Thank you so much, Aarti ma'am, for this warm welcome and for very insightful words. So as Aarti ma'am just mentioned, we also have our chair-elect, our respected Dr. Mr. Ashish Kiran Shrestha. So if he can give us a bit more insightful words and a small talk, if that's okay.
Okay, sorry. Thank you, Sasa. Thank you, Sasa, and Abhishek, Dave, Sarika, and Sanjay is also there for helping us with this IMT webinars. We have been quite successful in the past in running these webinars, and we have got really good feedback. And hopefully you'll get something out from today. And I think the IMT interview is coming up in near future. So best of luck to everyone. And hope you all have a successful outcome from the interview.
Great, thank you. Thank you so much, Mr. Shrestha, for your insightful words. So we're going to start the session now. So good morning, everyone, and good afternoon and good evening to the participants who are in Nepal and other countries, and very warm welcome to this NDA UK Internal Medicine Training Interview Preparation Webinar. As Aarti ma'am introduced, I am Sasha, one of the Internal Medicine Trainee Year 2 in Sheffield Teaching Hospital, executive member of NDA UK and the webinar organizer. So thank you all for taking this time to join us today. We know how important this interview is and how stressful the preparation can feel. Today's session is basically designed to make things more clearer, more structured, and more achievable. We will focus on the actual interview format, what the interviewers are really looking for, and the practical tips that you can apply immediately in your preparation. So please feel free to note down your questions. We will try to address as many questions as possible at the end of the session. So stay tuned for that. And also in the application form, we have noticed that we have some queries about job application and CV preparation, but unfortunately, we will not be covering these topics today. And this is primarily focused on IMT interview. But having said that, we are also organizing a mentorship program to help our fellow Nepalese doctors. So there is a chance to become a mentors where our fellow doctors will help, where you can help our fellow doctors. And moreover, you can improve your portfolio in leadership by doing that, and also become a mentee where help will be provided to answer all these questions and guidance. So, having said that, I will now start the session with our very first speaker, and it's my pleasure to introduce our speaker, Dr. Diwakar Hamal. Dave is a IMT trainee year 1 at King's College Hospital, London. He has a very strong interest in medical education and is currently taking postgraduate diploma at King's College, London. He's also working towards a MSc. He's very actively involved in critical care and is a FUSIC ultrasound mentor. In addition, he is a cooperative member of NDA UK as well. So today they will be talking about structure of the IMT interview itself, introduction part of the interview, and mainly station 1, but excluding the ethical station. So Dave, welcome and over to you.
Hi, everyone. Can everyone hear me and see my slides moving?
Yeah, it's working all good.
Brilliant. So thank you, Sasha, for that lovely introduction. So my name is Dev. I'm one of the IMT 1 trainees at King's in London, and I'll be going through the station 1, excluding the ethical scenario, and talking about the structure of the interview and giving my sort of main tips and tricks to get a successful interview. I know Sasa mentioned we'll take some questions at the end, but if there's anything you want to say, feel free to unmute yourself, and I can help clarify something that that's confusing, or anything else that you guys want me to go over again. So firstly, I'll be talking initially about the interview scoring matrix for IMT. I'll then go on to the station 1 structure, which is, or I'll be talking the main 2 parts being the application and achievements presentation, where I'll go through some tips and my feedback I got from the interviewers. And then next I'll talk about the suitability questions, and again talk through some tips and my feedback, and briefly mention about the communication marks as well. And then I'll end with some of the resources I used as well. So this is the interview matrix for IMT, and some of you guys might have seen this before already, but if you haven't, this is how it's split up. Obviously there's 2 stations there. The applications and achievements and suitabilities, the question 1. Next is the ethical, and then there's a communication mark 2. And as you can see, there's 2 interviewers that are scoring you out of 5. And I just put on the right here how what you want to score, which is 4 or 5 out of 5 in each of these sections. And how it's marked here is based on, so 4 out of 5 is based on a good level and a level expected on completion of F2, whereas full marks from each interviewer is defined as excellent and is level expected at IMT or above. I want you to point out as well regarding this matrix that there's a communication mark that you can see in both stations as well. And actually that makes up 20 marks. So the way you communicate to the examiners, your achievements, the follow-up questions, and even onto the clinical scenario, which my colleagues will be talking about afterwards, is really important as well. And it's something to be aware of. And as you can see as well, it's weighted as well, and it's then the weighting is increased for the total score of 96, but the raw score is out of 70. So just to go over that again, just to split the stations up. So station 1 is roughly 11 minutes. This is taken directly from the IMT website, and again, the raw mark from this station is 40 out of 70. The first part is the application achievements, which is a 2-minute oral presentation, which is scored 10 out of 70, which I've mentioned before. You'll then have 4 minutes of suitability questions regarding sort of the presentation and some follow-up questions. And around that, there's also a communication mark, which is 10 marks too. Station 1 also includes the ethical station, but I won't be going into that in detail. And that gives station 1 a total of 40 marks. The next station is, again, the clinical scenario, which runs over 11 minutes. which I think Abby will be talking about later as well. So I won't go into detail with that. So moving on to the first station, this is what you will be asked. So there'll be two interviewers, and you'll usually start with this one normally, and they'll ask you, give an overview of your achievements to date, which are most relevant to your application to be a trainee in internal medicine. This is the scoring matrix below, and we really want you guys to aim for that 4 or 5 out of 5. So just to read off, you can see achievements above expectation for experience and circumstances, and the highest achieving will be significantly above expectations for experience and very relevant as well. So out of mine, this is how I prepared for it. So what I did for this section was I write all my skills and achievements down on a Word document or a piece of paper into these 3 categories, and I kind of link them in prose afterwards. So, but for example, I put first my education sort of qualifications. So that included any teaching qualifications I had, any regional, local teaching roles I had. This is obviously ideally formal teaching, which you've got certificates for as well. If it's like a bedside teaching program, if it's a national teaching program, up to qualifications of teaching as well, I'd write all those down. And then sort of the next section would be my research sort of portfolio. So that would be any publications I'd have, any audits or quips I completed with relevant sort of presentation certifications, any sort of stuff related to the NIHR, which is the main academic body that involves research in the UK and the NHS. I then split it into clinical. So then sort of wrote down my technical skills. So one of them would be sort of any certification, any courses that I've done, for example, ATLS. This is an example, is an ultrasound course that I completed. Any exams as well is really important as well. You want to write down, for example, if you had part of MRCP done or any other related exams. And then on top of that, I probably wrote any other extra stuff that I'd missed. So like obviously prizes, any presentations that would be from local to international level, and try to link in some leadership as well. And that can be in clinical settings that you've had. So maybe leading a peri-arrest scenario, maybe involved on the ward, or even non-clinical leadership that can be involved in stuff that you've done outside of hospital, where you've led a society or a sports team, for example. What I try to do in this section as well is, and we'll go on to what the SIPs are. That's basically the IMT curriculum, what it's defined as. I try to link in some of the SIPs directly into my application achievements program. So, for example, they mentioned in one of the SIPs, they talk about being a clinical teacher and supervisor, and I directly quoted that in my paragraph of which I learned, and even looking at and then linking back to the skills I've gained for specifically linking to IMT. For this 2-minute presentation as well, once you've done all that, and you'll have lots and lots of drafts of this, it's really important to practice and practice and practice, because you have a really strict 2-minute time limit, and they will cut you if you go over. The way I did it, I mean, everyone does it differently, but it would be phone audio recording, so listening back to myself after speaking it, speaking in the mirror, speaking in front of my family and friends. I did at least 3 mocks regarding this presentation with colleagues before actually the interview day. But practice is everything, and it's always prepare to fail and fail to prepare is the mantra we use in these scenarios. Now, this is my actual feedback I got, which was sent to us after we interviewed. I'm just going to give you guys a bit of time just to read some of it. So the first panelist mentioned I had good teaching education achievements and interests, good research, and then they linked to some of the clinical stuff. And that's the way I'd sort of structured it as well, to make sure it was really clear to the interviewers that I was going through these bits. The second panelist was a bit more detailed. This was specifically about some stuff. So the ones I've highlighted, obviously, I mentioned talk about doing a regional teaching program. Was that really high yield stuff for interview? Talked about some of my publications and doing work within IHR. I then talked about maybe sitting my exam. So interest, I hadn't actually sat my exam, but sitting my exam in the future, which they picked up on. And then some other stuff. So some community work I also did. I relate to some outpatient stuff because obviously a lot of the IMT curriculum is involved in clinic work as well. So outpatient and community health is really important as well. Now, it's not to scare you if you haven't done all of this, but it's just important to highlight that you really want to make sure you sell yourself with your standout achievements and that the interview is really clear in what you're actually saying and they can then mark you accordingly. And that we want to aim for that 4 or 5 out of 5 in this section. So the following section is looking at suitability, and what they'll ask is sort of any suitability questions relating to IMT, and they will clarify any questions relating to your initial 2-minute presentation too. And again, it's similar in terms of the rating is you want to aim at 4 out of 5 or 5 out of 5 regarding sort of expectation related to experience and the relevance regarding to IMT. So I've written some stuff here, but the ones I put in bold is what I got asked in my interview. So they really want you to know it's the IMT curriculum training structure, and they talked about the SIPs, which some of you guys may be aware of and some might not be, but I'll go on to talk about that on my next slide. They asked me what my aspirations are as well after IMT and during IMT, and they asked me to describe an audit as well. Other possible stuff that I've heard from colleagues is they sometimes ask you similar questions, the follow-up questions like why have you applied, what qualities that make you a good trainee, what kind of commitment have you showed, which are very similar sort of questions as a follow-up question really. Similar with the audit one, they've asked about what makes a good audit, what are the challenges of audits as well. So it's important to have sort of points and preparation for these sort of stuff as well. I also prepared some questions that they thought they may ask, maybe if they ask, tell me about a difficult experience or communication. And some of you may have heard of the STAR structure and these sort of questions, which is situation, task, action, and result and reflection. Now, I won't go into detail about this, but there's some good interview books that help you prepare for these sort of questions too, which I'll link at the end of the presentation. So regarding the question I got asked regarding SIP, so SIP stands for capability in practice. And these are, you can see on the left here, are the 14 SIPs you really need to actually probably memorize regarding the IMT curriculum. Now, this is taken directly off the JRPCTB, which is the Joint Royal College of Physicians Training Board PDF, which basically outlines the whole IMT curriculum. And these SIPs are split into 2 types. There's the generic and clinical, as you can see there, 6 generic and 8 clinical. And in my interview, they actually asked me specifically what SIPs were, which ones are related to what I was talking about. And I think it's really important to learn these because you will be asked them directly. And speaking to some of my colleagues who interviewed last year, they also got asked this as well. So this is really important. The curriculum also is split into 2 other parts as well. So the SIPs are one part, and you actually link these SIPs to some of your SLEs that you do when you get your portfolio. For example, if you were seeing patients on a take, you'd link that to the clinical SIP number 1 and 2, where you'd be managing an acute take. The other 2 parts include the clinical knowledge aspect. So this is directly taken off the JRCPT website, is just being familiar with the key conditions and etiologies and features of the common medical conditions. And procedures wise, these are a list of the procedures you need to be competent by at the end of IMT 3, basically. IMT 2, 3, sorry. And that's listed there as well. And just I really recommend going on that website, and I'll link it at the end as well, just to be really familiar with the training structure, because you will be asked this most definitely. So the other question I got was, again, future aspirations. And the way I sort of prepared for these answers was using the mnemonic CAMP. This is one of an interview technique you can learn. So, for example, this is what I actually use for my one. So CAMP is split into 4 sections. So you've got clinical, academic, management, and personal. So when they asked me this question, I spoke about I wanted to complete IMT3, I wanted to complete MRCP, and I went further and talked about my plans for higher specialty training and aiming for national audit and leadership roles. This obviously shows aspirations, ambition, which the interviewers are really looking at interview. When I moved on to my academic part, I spoke about further publications and presentations I was keen to do in XYZ medical conferences, and even looking at some higher ultrasound accreditations as well. So you can link this to any sort of technical skills or any other audits as well. You can link that to that you're pursuing. Management-wise, I spoke a bit about leadership as well, and my enjoyment in teaching, and aiming to do obviously a further postgraduate degree. But yeah, you really want to, not everyone will want to do that or have exactly the same as this, but you really want to sell yourself again at this point and talk about your ambitions and aspirations. And I think the personal part is actually probably the most important. I luckily had a South Asian interviewer. She was a palliative care consultant. And I already spoke about the fact that I'm Nepalese and I'm part of this association, and which supports medical education. And I spoke about sort of the community work I helped with. So we literally, like a month before the interview, I was part of the NDA in helping the HEAT program, which is the Health Education Awareness program, and I linked that to helping with community work with the large Nepalese population in sort of the Hayes, Hillingdon area. I think that's really important too, because especially, I mean, look at a South Asian examiner, but I think having a really personal touch to these questions really makes the examiners remember you as well. And linking that with really your higher achievements, I think it really puts you in really good stead for scoring really highly in this section too. So next I've got looked about my audits QIP, which this is my sort of paragraph which I sort of already learned. And basically, if you're describing, you've all the guys have done audits or QIPs, what you really want to do is make it clear. So describe the aim of the audit, describe the methodology, the results, and the change. And you really want this to be very succinct and brief. You don't need to go and speak in very much of depth regarding the audit. So, for example, this one that I've written on the screen, I explain what it is, I explain the aim of looking at nitric oxide use in theatres. I talk about the quantitative data that we measured, the results we found, huge over provision, and I talked about the change of what we did and how that was communicated, and then where we presented it. So you see, you want something really just short and not too in depth, otherwise, because you can talk about your audit for about an hour if you talk about it in detail, but you really want to home in on the main points, and that's how I structured it there below. So I'd really recommend something like that in your structure. And this is the feedback I got from my section. So they spoke about me, because I spoke a bit about some of the work I did in intensive care, looking at treatment escalation plans, and they really picked that up in my feedback. They mentioned the part I want to sit MLC part 1, and again the community medicine part, because I think I could tell the interviewer liked my bit about regarding community health and helping a South Asian population, a very quite a high inequality aspect as well in that part. So they picked up on that I was involved in community medicine and managing chronic conditions, which really is an important part of IMT, alongside managing your acutely unwell patients too. Panelist 2 again was talked about sort of passion about future career as well, in obviously not having intensive care, but in any other career aspect you're thinking about, and having knowledge of the curriculum is really important too. So that's the first two sections sort of summarized. These are the resources I use. So the IMT recruitment website is really good. But you can just find that by typing IMT. But the two I really found useful was using MediBuddy. Now I think some of my colleagues here will probably second me saying this, but it was really good. I think you have to pay for it, unfortunately, but it had really good interview prep, looking at different parts of the interview and structuring it and preparing really well. So I'd really recommend using MediBuddy. And regarding the training program for IMT Stage 1, I would recommend using the Joint Royal College of Physicians Training Board's PDF, which, although is a long 20, 30-page document, you just need to know the basic outlines of the curriculum, which are the SIPs, the knowledge, and the procedures to be aware of, really. And that's it. Best of luck to all you guys. And I think we're taking questions right at the end. So I'll hand back to Sasa. Sasha.
Great. Thank you. Thank you very much, Dave. That was very excellent and very insightful session. And it's very rightly said, all the section of the interview is very important, but this section basically gives the first impression to the interviewer. So it is very important to do this section very right. So very good presentation. Thank you, Dave. Yes, we will take the question in the end. Now, I would like to invite our next speaker. Is Dr. Sanjay Shrestha. Sanjay is a IMT trainee year 1 at Maidstone and Tunbridge Wells Hospital. So Sanjay will be speaking about the clinical station of the IMT interview, focusing on how to approach the clinical scenario, structure your answers, and perform confidently during this station. So Sanjay, welcome, and over to you.
Thank you, Sasa. Hi, I'm Sanjay. I'm an IMT1 trainee at Maidstone and Tunbridge Wells Hospital. So I'll be talking about the clinical scenario presentation today. Let me just get this up and running. Where's the cursor? Okay, so I'll be talking about the station 2 clinical scenario today, which is like basically the second station after you go through your initial bits of introduction and ethical scenario. How do we move this one? Sorry.
Do you think
play
it, like there was a play button?
No, it's just give me a second.
Yes.
Sorry about it. Okay. So yeah, I'll be talking about the clinical scenario today, which will involve talking about the investigations, the diagnosis and management, and I'll talk more about the communication marks and handover. So objectives for today would be getting you familiarized with how clinical station will run through to understand how to approach the case and formulate different differentials, and get to know the steps of handover, which is one of the major section of the clinical scenario. So to talk about the overview of the clinical scenario, how it will run through is initially will be given a clinical scenario. It either would be read to you or most likely in together shown to you on the screen as well. And you will be given around 3 minutes of time to prepare through it. So as you are given the scenario, then you sit down with the piece of a paper and pen or pencil, and then you just start noting down the important stuff from in the scenario. I will strongly suggest you to make the note of the name of the patient, age of the patient, sex of the patient, and also the presenting complaint, because all these informations will be really useful throughout your clinical scenario station to answer different questions along with. And also at the end for the handover, it's very important for you to know the age of the patient, sex of the patient, their presenting complaint. Even the name of the patient would be something crucial. So I will strongly recommend you to note it down on that initial 3 minutes itself. Also, I'll recommend to note down the relevant past medical history, any drug history, any relevant family history or social history, so that it will be easier for you to formulate the differentials. And again, it will be easier for you to when you will be handing over the case. The next thing is, after you have been given the clinical scenario, then usually I'll also strongly recommend you to note down the differential diagnosis before the actual session starts, which will be 10 minutes long, where you will be asked different questions. And for the differential diagnosis, try to organize them and classify them, like what will be the infective causes causing those symptoms, what are the inflammatory causes or autoimmune causes, is there any tumor associated which can relate to the symptoms that the patient presented with, is it related to trauma, or is it any hematological or even the endocrine or metabolic abnormalities are associated. So you just try to classify them into different topics, which will make you sound very professional and organized as well. And sometimes what happens is, with the patient presentation, sometimes you can pin it down to very couple of specific diagnoses, but I will strongly recommend you to be more broad and think about a few more differentials, to tell the examiner, so that that will make them feel like about the topic, and you are open-minded as such. So that's about the differential diagnosis. And then basically how this station starts is like, once you are given this scenario, you get 3 minutes to prepare all those things, and after you prepared all those things, then they will usually start with how will you approach this scenario. Or sometimes they might just ask you what will be the differential diagnosis, and then run it along with. Just be mindful when they ask you how you will approach this case. So usually I will recommend that if the patient is unstable, acutely unwell, is in the resuscitation bay, or presenting in the acute medical unit or something, then I would recommend you to start with A2A assessment. And you need to be very thorough with the A2A assessment. So it should be in the tip of your tongue. Like I will from A to E, all the components should be on the tip of your tongue. You need to like complete this in, I will say, a minute, or at most half a minute or something. Okay, so you really need to practice it thoroughly, the A2A assessment and its various components. And as you go along doing the A2A assessment, you might be given some more details, some more information, some more findings, and you need to address them accordingly. Or even in the initial bit, when you are shown the clinical scenario, if there's mention of low blood pressure, low oxygen saturation, or mention of tachycardic or something, then try to address them when you are doing the A2A assessment. Like if someone was given the oxygen saturation of 80% and the clinical scenario, then while you are doing the breathing section of the A2A assessment, mention that the oxygen saturation was 80%, so is 80%, and then I would like to start the patient on high flow oxygen. So that's how you will be addressing along with. Yeah, and like basically, if the patient is very stable coming to your general clinic or something, then you can always start saying that you will start with the detailed history taking and go into the components of history taking. Like if the patient is in pain or something, try to explore more about the pain using the Socrates. Or if the patient is coming with some unusual symptoms, just try to explore more about it, gather the full history, including the family history, drug history, and take further from there. Okay, and after you do this section, then usually you will be given with the more information, some more investigation results. When you have mentioned that you will run through certain investigations, if you do not mention, like let's say if you do not mention of abz on your A2A assessment in a patient coming with shortness of breath or something, then they might not give it as well. So it's very important for you to mention that particular investigations as well. So as you go along, they will give you the results. But by any chance, if you miss to say any investigation which is very crucial for the station to go ahead, then they might usually prompt you as well, asking, is there any investigation in specific that you would like to do or something like that. So if it's coming that way, just be very mindful and think about what else you could do about the patient presentation. So that's the approach to the scenario. And then the next thing is they will be giving you the different results and everything. So you need to, very systematically interpret those results. Don't look into the specific numbers of anything, particular investigation itself. Try to analyze the whole picture and try to put the whole picture in the same basket and formulate a diagnosis. Just as if you see low hemoglobin or something, look for the MCV, look for the iron profile, vitamin B12 or folic acid level. Just think about if the patient is having any acute bleed, or if there's any other symptoms associated, or if the patient is having a weight loss or anything, to see if it is cancer related or something like that, and accordingly formulate the diagnosis. Okay. So that's about the interpretation of the results. And then
Sorry to interrupt, Sanjay. Are you changing your changing your slides?
is it not?
I think we can see. Is everyone being able to see the change of slides?
No.
It is changing. Can you change now?
It was not changing before, but
Yeah, it was in objective.
Yeah, it was an objective.
Oh, really?
No, but we could completely get what you're saying. So you can continue, but
Sorry about that. I didn't
no,
realize.
it's fine. I thought it was in my screen, but I noticed it for a long time. So no, that's fine. It was very clear what you have mentioned, but yeah, the slides.
So just to, very briefly, I'll show you the slides as well. So this was about the clinical scenarios, how it will run through, where you need to jot down important information shown to you in the initial 3 minutes, and then formulate the differential diagnosis accordingly, and classify and organize them. And then when approaching to the clinical scenario, if the patient is unwell, then you start with A to E assessment. And if the patient is stable, you can always take the detailed history taking and go along with. And then this was about the interpretation of the results, which is like basically, try to analyze the picture as in a whole, interpret the results in a collective way rather than just interpreting individually as such. And then I think we are here now, and in terms of the management. So in terms of management, basically try to address all the concerns that you have noted in the history, in your examination, and in the investigation results. Okay, so basically, if there was anything specific in the history in regards to the patient's social status or something, or any social concerns, their mobility, then you will have to address it accordingly. Sometimes it becomes a bit hard to think about in terms of management. Okay, it's an upper GI bleed. I will do IBPPI or something like that, and then you will run out of the options to say what else to say in the management. So at that time, like, you can simply start with, I will admit the patient ideally in a gastro bed, or if the patient has like infective symptoms, you can always mention about, I will admit the patient in a side room. I will reconcile the medications. Initiate the VT prophylaxis in appropriate situations or any appropriate case. And if the patient is elderly coming with the fall, you can always say involvement of occupational therapists and physiotherapists. And always do mention about the treatment escalation plan. That's really important. And also, like, in a variety of situations, you can always say, I will involve the multidisciplinary team. That's usually that which we do in a day-to-day practice as well. And I think the examiners will like these words, basically the treatment escalation plan, resuscitation status, multidisciplinary team, OTPT, side rooms. I think the examiners will love to hear these words, and they will feel like, oh, okay, this guy knows, this person knows about the NHS system, how it works, and the different services available within the NHS. So and then after this, like, basically the question answer will be running for around 10 minutes, and after the 10 minutes for you to practice as well. So basically, when I started my presentation, I told you that to note down all those name, age, presenting complaint, relevant past medical history. So all this information will be very useful on this handover scenario. So when you will be asked to hand over, use the SBAR format, which is as stands for situation, in which you will be talking about the diagnosis and presenting complaint, and in background you will be saying about the relevant past medical history, drug history, or social history, and in assessment, basically you will talk about the current status of the patient, and in the recommendation you will be saying, letting the doctor on the other end know about the plan going ahead. So just to explain a bit more about the SPA handover, I have just assumed on one of the clinical situation here, and then formulated the section of it. So basically, let's say if there was a patient who coming with the progressive shortness of breath, with productive cough, fever, and then basically you have managed it throughout the station, and you've been asked to do the handover. Then how you do is basically at first you introduce yourself to the person on the other end of the phone, or in face to face. So you can say something like, "Hi, I'm Sanjay, one of the medical F2," and then you can say about the patient after that, "I'm calling about Mr. Smith or somebody, 55 years old male." So all this information, it will be easier when if you have noted it down in a piece of a paper at the start itself, because it as the station runs through, it is very prone for you to forget the name, age of the patient, and so it will be a nice thing if you would have noted it down at the start of the station, and when you are handing over, like if you say these informations, it will look good. So you can say, "I'm calling about Mr. Smith, 55-year-old male on acute medical unit with exacerbation of COPD in type 2 respiratory failure." So you can interpret the ABs given and say about this type 2 respiratory failure as well. You can also include, like, if the patient is in mild, moderate, or severe or life-threatening exacerbation as well. That will be very nice to add in as well. And on the background, you basically talk about how the patient presented, relevant medical history, and anything relevant to the patient presentation. So on this situation, in this scenario, I have added on, like, he presented due to progressive shortness of breath and is known to have COPD with 2 previous ITU admissions. So this will be something relevant for the other person who is at the other end. And then we will be talking about the assessment. In the assessment, basically you tell about very specific thing, like how the patient presented, what have you done so far, and how he is doing of now. Okay, so in this, basically I have mentioned he was hypoxic and wheezy when presented, for which is requiring high flow oxygen and is receiving back-to-back nebulization. He now looks tired and is on type 2 respiratory failure. We have also given him IV antibiotics. So this is the assessment part. And on the recommendation, basically what are the recommendations that you are going to give to the person at the other end. So in this situation, I have mentioned, "I think he is deteriorating and he will require non-invasive ventilation or further support. Can you please come and review him urgently?" So this is how we do the ASBA handover. Again, like, as stands for situation, where you will be introducing yourself, telling about the patient's identity, and then the diagnosis, and in the background you'll be telling about the patient presenting complaint, their relevant past medical history, and anything related and significant. And in assessment, you'll be talking about the how the patient presented, what have you done so far, and how is patient now. And in the recommendation, basically what you would like the person on the next end to do for the patient going ahead. Yeah, so that will basically end the station. So these are basically the areas of assessment which I have taken from the GRCPTV website. So there are 3 separate marks awarded for the clinical scenario station. One would be for the investigation, diagnosis, and management. One would be for the communication skill while you are going through the station. So within the 10 minutes, sometimes they might ask you like basically, can you explain about the diagnosis to the patient, or can you talk about the treatment escalation plan to the patient? Things like that can be asked within the 10 minutes as well. So in that they will usually judge you on your communication skills, and at the end it will be the handover always. All right, that's all for me. Thank you very much.
Great. Thank you very much, Sanjay. That was, again, a very excellent and very helpful session. So, as you very rightly and very extensively explained, this interview basically will mark you for your clinical knowledge. And they also want to see your limitation so that you know what your limitation is, and then you escalate at the right time, your escalation skill and also your handover skill. So, it was very well presented. Thank you, Sanjay. Now it is my pleasure to welcome Dr. Abhishek Tamrakar. Abhishek is a IMT trainee year 1 under Sheffield Teaching Hospital, and he's also an executive committee member of NDA UK. He will be talking about the ethical station of the IMT interview, including how to approach the ethical scenarios and the structure, and how to structure your answers very clearly and safely. So, Abhishek, welcome, and over to you.
Thank you, Sasa. Dave and Sanjay has done most of the part to guide like how exactly the scenario is going to be. So if you guys can see the screen well, and you can hear me clearly.
Yes, can hear you and can see the screen.
Great. So hello everyone, I'm Abhishek, one of the IMT's one here in Sheffield, and also an executive member. I'll be discussing about how the ethical scenario exactly runs. So I'll be dealing with ethical, professionalism, and governance scenarios. It's one of the toughest area where you can score marks. Often people say, but I think like it's one of the easiest area where you can score marks. It adds up like quite a lot in your marking, and it's always helpful to be a bit more lenient towards like what you answer and prepare well before going towards the ethical scenarios. It comes up as a substitute scenario, like a sub scenarios for the station one that Dave earlier mentioned. It's a part of a station one, and it holds quite a lot of marks. So what I'll be discussing is like it would taste your ability to respond to a difficult scenario that you could face. It's basically like dealing soon after they ask you to introduce yourself, they will give you a scenario and you will be judged upon by two of the invigilators. You'll be given almost like about 5 to 7 minutes of the time. The station one has got 11 minutes and station two has got 11 minutes. So out of the first 3 minutes that they've explained, the rest of the time you'll be doing the ethical scenarios with on the same station. So what they exactly would score is like the score is 28 out of the possible 96 that you can get. 12 is for the ethical professionalism and governance, and the rest of the 16 is for the communication, which would be carried up with the introduction of the IMT, suitability for the IMT, ethical, how you communicate well, and also with the clinical scenario, but it has got like a separate marks for communication itself. So the 16 is specifically for station one, and it will be judged upon that. So the scenario would be read aloud to you immediately after starting the station, and you'll not have any time for preparation. Like Sanjay told, it's always better to have a blank piece of paper and a pen. As such, you can note down if they say any name, because it's really hard to remember names. Even now, while we're working in the wards, we do not remember the name of the patient. So it's always better habit to write the name of the patient and age. If they want to discuss about the ethical scenarios, they would be saying, okay, his mother or his father or his son wants to speak to you. So you need to make sure like which kind of relation are you going to speak to later in the scenario. I always suggest, because it's a very short duration of time, so you need to you must have a structure to deal with this kind of scenarios. So it needs to be like effective and cohesive answerings. So you only have got like very short amount of time. Just be mindful of that. This thing Dave has already introduced to you all. So the target is to get 4 or the 5s to get a good IMT score and get a good rank. This is the general question framework. Again, we would be expecting 4 or the 5 to get through the IMT interview. So either you need to perform like at least higher than the F2s or at the level expected for the IMT. This is the scoring criteria which we have already gone through, and you can see the station 2, question 2, it holds the ethical marks, which is 12, and it also includes the question 3, which is the communication marks, that's 16. So to deal with any sorts of ethical scenario, I would always suggest to use this mnemonic, I spied, which I had made a pro forma for it. Like any sorts of scenario it comes, I will drag it into I spied and I would deal with that. So the first thing that you need to address is like what kind of issues has been raised in that scenario when they read aloud. Okay, just make sure that they do not give you a poster or they do not show it on the slide for the ethical scenario. They will just read it aloud and you have no chance to go back and see the scenarios like you can do in the clinical scenarios. So first of all, always mention like what issues has been raised for the scenario. I always try to like summarize the scenario from my perspective and then mention that, okay, the scenario raises 2 key issues like patient autonomy or confidentiality. It could be anything. I'll provide a list of the possible scenarios or the possible issues that you can mention. I hope that helps. The next thing would be like seeking some information. It's not that you can seek only information from the patient or the visitors. You can also seek information from the invigilators themselves. Okay, so I remember in my scenario, I asked like, do I have a permission to speak with the visitors? The patient was in the ITU unconscious. So I wasn't aware, like, should I go and speak with the visitor who was waiting outside the ITU or not? So this would be like seeking information is definitely important. So I would like to speak with the patient family to find out more about the exact concern. Would be a good line to start. The next thing is about patient safety. As GMC demands us to be a safe doctor. So whatever the situation is, always try to make sure that the patient is safe. So your questions should lead towards the safety of the patient. Continuing with the mnemonics, the next step would be the initial measures that you would do, like what you could do in the situation to help to resolve it. And like I would start my answers as like I would first like to approach like this is a scenario when a colleague is trying to do something that's not ethical. So I would say like I would first like to approach my colleague to see if they would accept whatever the recommendation that I have given. So that would be like the initial measure that you can do. The next thing would be like escalation plan. You need to have escalation plan for any kind of ethical scenarios. Like what would you do? Something that you have already done, and if it does not get better, like what would you do next? So you need to explain about that as well. And the most important part is documenting and reflecting. Often people forget to say about it, but I would recommend like everyone to mention about the documenting thing and the reflecting thing, because here in the NHS, I think like it's more about documenting, and even in the IMT trainees, like reflection is one of the most important part of your portfolio. So for an example, this is the scenario that I had used. It's just an imaginary scenario, nothing to do with the interview itself. You noticed a colleague in using a personal email to discuss patient's information and to keep record of the patient information. What will you do? So this is how they read aloud. In in the issue section, like how you can mention, like the two key issues that I can see from this scenario would be a confidentiality and a professionalism. What information, I would like to seek information on why they are using their personal information. With regards to the patient safety, I would like to ask, like, what details have been shared? Like, was it a photograph? Was it just the hospital number? Was it the information about the patient's residencies? All those informations, just to make sure that the patient is safe. The next thing would be the initial management, for as this is a conversation kind of ethical scenario. So it would be, I would be having a conversation with my fellow, and in case if they agree, it's all done. In case if they don't, I need to escalate it to the respective seniors. It would be the educational supervisor or the clinical supervisor to escalate first. And in case if it does not works, I might need to speak with the trust information management team as well. I would then mention about documenting and reflecting it, everything of whatever the conversation that I had with him. This is just the score that we usually get. This is the feedback form once you get after your IMT about what scenario that you have gone through and what are the recommendations that you can get. So it's about the ITU scenario that I got, and the comments were from the panelists 1 and 2, good understanding of the ethical principles, issues, ask about appropriately about the pulse and support and everything, because in my scenario, the daughter was not happy. So in every ethical scenario, like I would just like to briefly mention like what exactly the examiner expects you. And there are a few words like you must say to get good scores for the ethical scenario. So the 4 main principles of medical ethics that we say is autonomy, which we all know that all patients with the capacity have the right to make their own decisions. Beneficence is like maximizing the benefits of our actions to help the patient. Non-maleficence, as we must strive to avoid causing harm to our patient. And justice is like any decision must be fair between individuals. Everyone should be treated equally. So most of your answers would roam around these 4 principles whenever you start with the issue. The other things that you could include to your presentation would be like the capacity of the patient. By capacity, I would say the mental capacity of the patient. If you're talking about best interest with someone who lacks mental capacity, right to confidentiality is like you need to make sure that you're giving out information to the person who is the next of kin or someone who has the lasting power of attorney of health. There are 2 lasting power of attorney. So one would be for the health, one would be for the wealth. So you need to make sure that the person has got lasting power of attorney for health. And you can seek this information from the invigilator itself. And duty of candor, sometimes they put you in a scenario where you have made a mistake, and how would you respond to that? So you should be mentioning that, okay, this scenario explains the issues of duty of candor on confidentiality. So depending on that, you need to structure your answer. So I spied is like a key mnemonic to get a good score in ethical scenarios. Regarding the mental capacity assessment, I hope most of us have gone through this mnemonic. It's like plum B that we say. So plum B is presume that they have capacity. So anyone for whom you are accessing a mental capacity, you should not assume that they don't have a mental capacity. The other thing is like you need to be least restrictive towards them. Unwise decisions does not mean that they lack capacity. So sometimes we encounter patients who takes unwise decisions, and we often say that he doesn't have a capacity. Maybe he does have a capacity. So we need to be careful on how we interpret our results. We need to maximize our capacity and always think about the best interest. So MCA principle is one of the question that you might get in your ethical scenarios. The other useful tools, topics that you need to learn about is the same Mental Capacity Act. Like, what's the new Mental Capacity Act that's followed in the UK? What is it about the lasting power of attorney that I have just mentioned? Like, there are two, health and wealth. So make sure that you go through them. They might ask you some questions regarding that. We have been using tolls quite often in the NHS. So deprivation of liberty, safeguarding. They might ask you a question like, how is it done? Or when is it done? Who does it? So try to go through what exactly is tolls and try to understand it. It helps a lot when you are explaining it, because you only have got like 5 to 7 minutes to do all these. Gillick's competency, and there's a good website, NSPCC Learning. I just went through that as well. So it provides good information about how to assess a Gillick's competency. So I would suggest everyone to go through that too. And also a DVLA restriction. So sometimes a patient might be diabetic, and they might be driving big lorries, or they might be driving cars. There's a different DVLA restrictions for each. So this all comes under communication and ethical scenarios. So just be aware of that. This is the sample scenarios that I was talking. The issues I have tried to make sure, like, to address few issues that might come in, like the patient who is refusing treatment and wants to self-discharge. They often put you in the scenario, something like that. So what would be the issues for those kind of patient? It would be like the capacity of the patient, the mental capacity. Every time I say capacity, it's the mental capacity. The next thing would be like the best interest of the patient. Any kind of prescription error. So it's the duty of candor. The two issues that I could raise is the duty of candor and the patient safety. If someone is late colleague or drunken colleague, so seek information, offering help, and suggest respective department to seek help. These would be the issues that I would need to address. Giving information to the patient family, the issues would be confidentiality and permission, and whether the patient has got next, whether the someone whom I'm giving information is the next of kin or not. Unusual bruising, it often comes with elderly or the children, so the issues would be safeguarding issue, mental capacity, and social services. Misplaced nasogastric tube, it's kind of a never event. So you need to mention these keywords like never event. And it comes the issues as patient safety, incident reports, escalation to seniors, and duty of candor in case if you are able to identify that. So these are the key issues that you need to always make sure that you mention before you start explaining and before you start going deep into the clinical scenarios. They like it very much. This is the resources that I have used during my IMT interview preparation. So it would be the Oxford Situational Judgmental Test book. This provides you some kind of clinical scenarios and the proper answers to it. Also, the good medical practice, I would suggest like just print it, go through it almost like every day. It will guide you a lot for your overall preparation for any kind of interview. It's not only the medical IMT interview, it's for like any kind of interview. Even if you're seeking job, like good medical practice is what they are looking for. There are, as Dave earlier mentioned, like you need to go through lots of mocks. So I would suggest to practice more with your colleagues, with your seniors. I was offered interviews by even from one of my departmental consultant as well, because they wanted me to be prepared for the interview. As such, like I would not miss any of my points. So I even gave a mock interview with my consultant while I was working in the department. And also NDA previously used to do a lot of interviews, and that helped me a lot. So it's all about practice. And at the end, I would say like, yeah, you got this.
Great. Excellent. Thank you very much, Abhishek, for very clear and insightful talk on the ethical station. We really appreciate you sharing very practical guidance with us today. And it's very true. We, as an international medical graduate, we will be very used to answering all the clinical questions that we have been doing. But the ethical scenarios and everything, it's very new for us. So we need to work a bit more in this section and get used to the possible scenarios that they might ask. So yes, that was very helpful. Thank you so much, Abhishek. So now we have tried to answer some questions in the chat box, but the floor is open for the question. So if you have any question, kindly raise the hand button in the meeting and we are more than happy to answer the question. So most probably for next 10 minutes, if that's okay. Great. Or yeah, any questions at all? I can't see any hand raising at the moment. I'll just give 2 minutes.
Hello. Sorry. Hello.
Hi, Benisha. Hi.
Hi. I just wanted to know regarding the 2 minutes one. It's so time limited, like how to squeeze everything in it. I'm like, I have tried to make one, but it's so like I cannot like what to mention and what not to mention, or just touch bases, or like just say that I've done an audit. But if I start elaborating a bit, it just gets a bit more. And then if I talk about publication, it's just like how to just minimize a bit. I don't like just a bit of idea about that.
Yeah, I think Dave will be the best person today to answer this question.
Yeah, hi, Benisha. I think good question. And when I wrote mine as well, I initially struggled. I think you really have to think about it's hard to make everything short and succinct, but you really just want sort of short facts. For example, with the audit, like if you a sentence or two, so what the audit was on, where you presented it, and that's probably about it. That's all they want to know, really. It's your achievements. That's what they're focusing on. Okay. Similarly for other stuff as well, maybe just write one short fact regarding it. But I'd really highlight that the communication of it and the structure of it and is really important, and they will cut you off if it's over. You should really practice to be 1 minute 59, like maximum, really. And don't try to rush, because if you write too much, you may end up rushing, and then your speech may be affected as well. So I think in that situations, maybe just cut out bits that you think, you know what, we might not need this. It's not one of the highest achievements that I have, and try to cut down maybe a single fact for those like audits, research, and then so hopefully then you don't have to rush it, and you can just speak clearly and concisely when you're delivering a presentation.
Sure. Thank you so much.
Yeah, that's how we do it, basically. Great. Any other question? Nothing in the chat. No one is raising hands. Okay, great.
Were we that clear?
I have one question.
I hope so. Great. Hi, Jana. Hi.
Hi everyone. Thank you so much for organizing this interview session. It's quite helpful for us. So I have actually two questions. Like my first question is, if we have done like in regards to publication, if someone has published 2 articles in PubMed, how do we present that in our 2 minutes presentation? And my next question is, whenever we are asked about, okay, tell me about your QIP or tell me about your teaching, if we have done like more than one activity, how do we present ourselves? Like, do we have to present only one out of 2, the best one, or do we present like in brief of both of them and present like one as a whole? or how do we present? And do we have to give a background about what do we understand about QIP while explaining about what we have done in QIP? That are my questions. Thank you.
Yeah.
Yeah, I think
I can answer that. Yeah, thank you, Sajaya. They're really good questions. So I'll try to tackle them in order. So the first one you spoke about publications. I would honestly, the way I did it was just be like, I have two PubMed publications. One, I'm first author. One, I'm a co-author. And the most recent one being, and then the X title. That's honestly how I did it. I didn't really go into detail about the publications. All they want to know is that what level author are you? Is it PubMed cited? That's really what they really care about. And then it's really literally one or two sentences then. The second one's about the teaching. I think when you're doing these, you really want the headlines, like you're doing a handover for these things, okay? The headlines are the first things you want to say. So, and that's the highest yield. So your best teaching achievement, whether that being a regional teaching program, if it's a local teaching program, you want that to come up first. So saying, for example, I've led a local teaching program in this hospital, blah, 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 and this is what we did. But there has to be a very, very short summary of it, really. If you've got multiple, you can say, for example, I've led on this, and then alongside this, I followed up and I've led or I've been involved in this teaching program. So really, literally one sentence, because the time, it goes quick and you've got a lot to say. And again, remember, it's headlines and achievements. That's what they really care about in this part. The final thing, what was the last bit? Sorry, you mentioned. I missed that.
Yeah. So my next question was, after 2 minutes, so we will be asked about, like, tell me about your QIP, tell me about your teaching or your presentation. So while answering that question, how do we answer that question? Do we straightly jump into what we have done, or do we give a brief background about what do we understand about QIP, or why do we feel teaching is important for us? How do we answer that question?
No, I wouldn't talk about why QIP is important in this part. They may bring that up in the suitability part, but I think it's the achievements of that QIP or audit. So, for example, what I wrote was I have led a full cycle audit in XYZ and presented it in XYZ. So you don't need to go in detail regarding audit QIP in this bit. Just focus on the headlines and the achievements in this part, because they may follow up questions, ask you about the audit in the next part, and you really only have 2 minutes. So again, you want to make that really short and sweet.
Sorry, I have one more question as well. So in my oral application, what I have done is, in my international presentation, I presented my QIP in an international presentation. So I have added that QIP in the presentation part because that was my presentation, and in my QIP bit I have added the QIP that I have done in pediatrics, but that's not in IMT. So if in case if on the day of my interview, if they will ask me about my QIP, which one do you suggest me to explain? The one that I have presented internationally that is related to medicine, or the one that I have done in pediatrics and that I have actually written in oral form?
Good question. Again, I think obviously just saying in the oral presentation you've presented internationally, you don't have to get the details. And if they ask you follow-up questions, like, tell me about this QIP or another QIP, I'd probably relate it to the medical one rather than the pediatric one, just because the examiners are going to be medical consultants. They're not going to be pediatricians. So yeah, I'd probably do that way. So let's just say in the presentation, you just write, I presented X internationally. And if they follow it up with, you just say, I presented an alternative audit. This was what the medical one I did, and then to go through that. That's what I would do personally. Happy to hear other suggestions, but.
Yeah. So one last question, like if I will be, so on the day of my interview, after my 2 minutes presentation, if they ask me about QIP, and then if I explain about that presentation one, and then will they ask me about the question about presentation again, or will that be only one question for these CV?
No, so what I got, so in my presentation, I just wrote, I led 2 full cycle audits, blah, blah, and presented this. Then afterwards, all they asked was, tell me about a QIP audit that you've done. So it's a very generic question. They're not trying to trip you up or like go tell me about this specific thing you told me. It's just a generic, just tell me about an audit that you've done. You don't need to worry about if they're trying to catch you out or you have to link it exactly back to your oral presentation. But it's just they want to know if you know what a QIP is and how you undertook it.
Okay, so it is not necessarily that I have to explain exactly what
No.
I have written in oral. I can say some other
No.
audits that I have done as well.
No, yeah, definitely. You can do that, yeah.
Okay, thank you so much.
It's okay.
Thank you, Dave. Any other questions, anyone?
Just a quick question for Sanjay in terms of the ABCD approach. Is it just 1 minute that we get, or is it like a duration of time and then they will just stop us and then they'll ask questions and then is it a flow up question, or we just say, oh, ABCD, like that, or how does that work?
Yeah, no, it's not like time limited or anything, but it's just that I would strongly recommend you to be very thorough, and like, if you are doing the A2E assessment, try to finish in somewhere in between 1 to 2 minutes maximum. Because if you will be, saying a lot of A2E, taking 2-3 minutes, like 5 minutes or something on the same thing, then there will be no time for you to get any other tag questions and things like that, and they will feel like you are not thorough with the A2E assessment itself, so which will not be a very good thing as well. So I will say, it's not a time limited, like they will not stop you or anything, but it will just linger on the things and it will just kill your time. So just start very fluently, like say on airway, if the patient is speaking, so airway is pretend, I will check for the oxygen saturation, respiratory rate, oscillate the chest, send ABG chest x-ray. Just be very thorough and organized, and if you have found like the oxygen saturation was somewhere an 80 or something, like in which the patient requests oxygen, you can just say the saturation is 80%, so I will start the patient on 15 liters non-rebreather face masks and just carry moving on that way around. It's not a time limited, but it will make you look professional. They will feel that, okay, this person knows the stuff very well, so when you are very thorough answer, I'll strongly recommend you to practice that thoroughly.
Sure, thank you.
Thank you, Venice.
Great, amazing. We now hope we could answer all of your questions, but even if there are any other queries afterwards, please feel free to email us in the email ID provided. Now, I'd like to take this time to sincerely thank all of our speakers for today's session. Thank you for sharing your time, your experience, and very practical advice. So your guidance have been extremely valuable, and I and the whole NT UK team, and I would understand the participants are grateful for your support as well. Just about the mock interviews. So this will be organized very closer to the interview dates. And also we have to take account into both the interview schedule and also the mentor availability. So as part of our ongoing effort to support our community, the mock session will be offered to NDA UK members only at the moment. So yeah, that's for it. And I would like to take this time also to thank Dr. Sagarika Pandey, who is here with us. She will be helping organizing all our mock sessions. And thank you all the participants. Lastly, we have also shared a feedback form and a feedback QR code. To support us, please fill up the feedback form so that we can make this webinar more useful and organize more and more webinars for all our fellow Nepalese doctors. And yes, I'd like to now request our respected chairperson, Dr. Arti Thapa, for the closing remark. And also thank you, Dr. Thapa, for all your encouragement and support for us to organize all these educational webinars. Thank you. Over to you, Dr. Thapa.
Thank you, Sasha. I have not been, present throughout, but I have joined towards the end, and I've listened to all the valuable questions and the answers that you all provided to the candidates who are sitting for the interview. Clearly, NDA has been helping our, trainee resident doctors for years. And I think currently the initiative from a lot of enthusiastic IMTs like yourselves is going to take it further. And I really urge the participants to join NDA, be a member, and take the full advantage of our membership and all these sessions. And I hope that today's sessions provided by all the IMT doctors has encouraged them, empowered them, and also prepared them to sit for their upcoming interviews. So my best wishes to them from NDA and from the executive committee. And thank you to all the four of you who have spent quite your time and also done quite a lot of preparation behind the background, which a lot of people do not see. So it would be really useful for the candidates who have attended today to give a feedback, because at the end of the day, reflection feedback is so important in education and improving yourself. So thank you again. Thank you all for joining, and thank you for all the providers of these sessions, and the Sasha, a moderator, and all the work you all four of you have put in today. Thank you.
Thank you so much, ma'am. Thank you. Lastly, I would like to request, if it's okay, if you can turn on your camera so that we can take a group photo, if that's okay. If not, it's fine as well. Thank you.
Yeah, I'm taking the picture. Say cheese. Great.
Great. All the best, everyone. Do well. We would like to see all the Nepalese doctors being great and doing great in all the interviews and in any career path. So thank you for joining. Do fill up the feedback form. If any question, let us know. And yeah, become a member to participate in the mock interviews. Hopefully, we'll be able to help you more. Great. Thank you, and have a good day. Bye-bye.
Bye-bye.
Bye.
Bye bye.